Hi, I'm Dr. Michael Vachon with the Center for Performance Medicine and Rehabilitation. Thanks for joining us today. Sorry we were late. We were having some issues with Facebook going sideways again, and we definitely didn't want that to happen again. I didn't want to have to come in on a Saturday. I didn't want to have the person that helps me film come in on a Saturday as well. So please let us know if for some reason you're seeing it different. If it flips on you or goes sideways, please let us know. But I think we got it figured out. So again, I apologize for being so late. Today we're going to start our whole body series. This is a series of 6 lectures that I'll be going from head to toe. Today we're going to start healthy head, healthy life. So let's get into it and talk about what we're going to be seeing in this 6-part series. So first it's going to be healthy head, healthy life. Then it's going to be smartphone shoulders. Okay, how many of you are dealing with those slunching shoulders? Your back pain questions are answered, so please, that's when we really want interactive. We want input. Please be asking us questions on Facebook or email us and give us that information as well. Healthy hip matters, okay? So I would say any sport, the hip is a crucial mechanism for its health and its flexibility and its strength and its power for the success of your sport. So we're going to be digging into that. Protect the vulnerable knee. Yes, the knee joint is one of the most injured joints in your body. And mostly what's securing that joint together are a series of muscles, tendons, and ligaments. It's kind of out there all by itself. So we're going to be getting into that. And then relief for those achy ankles and feet. Okay, again, many people are dealing with chronic ankle sprains, chronic stress fractures, all these different types of things that can happen. So we're going to be getting into that. So today, we're going to start with healthy head, healthy life. So, what's a healthy head? Well, it's a relaxed head. It's a low tension head. It's a pain-free head. And a head that has full range of motion from its neck, okay? So, relaxed, yes, everybody can be actually beneficial from having a day of relaxation, okay? Low tension, again, I have 4 children. Unfortunately, we don't have a lot of low tension moments, but I love them all. Pain-free, that is a big thing. Man, you don't want to be walking around with a headache. You don't want to be walking around with upper neck pain or lower neck pain. And then that free range of motion. You want to be driving and really be able to see all around like you should. Have a real good peripheral motion. Many of you may be out there, you can barely turn your head this way, or you barely turn your head up. So you gotta rotate your whole body to look over your shoulder. That's not healthy. So, best indication of an issue is a headache. Yes. So we're gonna dive into that. We're gonna be talking about 3 main types of headaches. Now there's a variety of more headaches than what I'm going to be talking about today, but I'm going to talk about the common headache that people are aware of or actually experience. Those 3 common types of headaches are tension headaches, migraines, and cervicogenic headaches. And we're going to be getting into each one of those and what exactly they mean and how those symptoms arrive and many of the causes and also the treatments that we do here at CPM&R as well to help with those things. So let's talk about when to contact your doctor with headaches in general, okay? If headaches disrupt your life or you need to take medication weekly for your headache, see your doctor. There's got to be something going on. You have to be able to rule out the emergency type of situation as well as rule out something that can become chronic. That means it can continue to happen over and over that you deal with on a daily basis for months, sometimes even years. Even if you have a history of headaches, see your doctor if the pattern changes or your headache actually suddenly feels different. There's a lot of different things that can cause headaches, and we're going to be talking about those. So that is a really important indicator that you need to have some professional eyes on what is going on. When to seek an emergency room help? An abrupt, severe headache. A headache after a head injury, so after like a concussion, or you've been in a car accident and you hit your windshield, which you probably have a concussion, or hit the back of your seat, or major impact in a football game, and you feel after that. A girl soccer player, okay, that's a big one that we see. Or let's say that you're a dancer and you're just whipping your head around a lot, and all of a sudden this abrupt headache, severe headache comes on. Those are all reasons to get those things looked at immediately. Headaches with double vision, weakness in your arms, your extremities, okay, arms or legs, numbness in those areas, and especially if you start to have difficulty speaking, okay? That can be an indication that that headache or what's causing that headache is affecting the cranial nerves, and that can deal with the central nervous system, and that's when things get really serious. So in those situations, many times when you go to the emergency room, they'll sit down with you, they'll take hopefully a very thorough history, including your personal history, as well as a family history, as well as current and past medications that you've been on. They'll be talking to you about any traumatic history, meaning any head injuries, what type of sports that you may play, have you had episodes of this before, so on and so forth. Also, they'll really want to know your family history as well. Does your mom or dad have a background of headaches? Your sister, your brother? Has anybody been deceased because of a headache? And that's how it started, like an aneurysm or a brain tumor or something like that. And after they take that history, which is so very important, it gives them so much good information, they should do a thorough neurological examination, sometimes orthopedic examination as well, depending on what they're seeing in the history also. That will help them get to the point where they would use imaging for testing. And that is the most conclusive way of ruling out the really bad stuff that can happen associated with a headache. So one source of imaging they use is what's called magnetic resonance imaging, and that's what we know as an MRI. Combines the radio waves and a magnet field that all feeds into a computer. That's why you can't go in there with any metal on, or you have to tell them if you have any metal objects. Or you work in an industry where there's possibly metal that could get into your eyes or your ears. Possibly at a machine shop where you have steel chips and those things that are actually could happen. Another source of good diagnostic instrumentation is a CT, computerized tomography. That is actually diagnostic imaging that uses a series of computerized X-rays that provides a very comprehensive brain image. Now both can supply a very comprehensive brain imaging depending on what the physician is looking for. They may choose one or the other, okay? So aneurysm, brain tumors, all those different effects of gray and white matter, so on and so forth. So that will give them that understanding and give them that choice as far as what they would make for that recommendation. So let's look at the primary causes of headaches. Now I'm going to categorize it into that tension, that migraine, and that cervical genic, but I just want to give you a basic understanding of typically what a headache's going to be outside of that emergency mode or that emergency situation that we just had talked about. So overactivity or a problem with the cranial plane or sensitivity to those structures. There could be a variety of reasons why that occurs. It could be from a concussion. It could be from an impact. I mean, there's a variety of things, which usually is going to precede a concussion of some mild, moderate, or severe. Chemicals can activate things. Certain hairsprays, there's a lot of chemicals out there that can affect certain people that trigger those headaches. Problems with the nerves or the blood vessels. So headaches can also involve the nerves as well as the circulation of the blood in your body if it's too high. Many times people with high blood pressure suffer headaches that they don't understand or can't figure out what is going on. And then problems with in your head or neck, and that's where we're really going to look at the cervical genic headaches. Many times an issue in your neck can actually resolve what's going on with the head because of the skeletal structure, the muscles and joints and ligaments and tendons that are in that area. And when those are affected, they have referral pain patterns that actually go up into the head and can give you symptoms of head pain. Other causes of headaches that you may not think about, these are things that usually can be resolved. Lack of sleep, well, if you're a parent, sometimes that's not really logical, or you're studying for a test, or you got a lot on your mind sometimes, or if you have sleep apnea or sleep disturbance issues, that can be affected. Stress, stress is a big thing as well. And typically these aren't affected by underlying illnesses or disease, but lack of sleep can have that effect with that, okay? Stress, usually that's removing yourself away from the stressful situation, be that emotional or physical stress. Loud noise exposure. If you're at a concert many times and forget to bring your earplugs, or you have sensitive ears, those can have a tendency to also cause headaches. Incorrect eyeglasses or prescriptions. Now, I have a good friend that's actually our family eye doctor, and she's awesome, Janae Cadlick. Thank you so much, Dr. Cadlick. And we talked about this before, and how headaches can actually really, with the right prescription, or many times people figure out, wait a minute, okay, now I need magnifiers, or now I need to get a prescription, where before they had been, just moving that object further and further and further away from them, or just needing to brighten the page up so that they could see it better. But actually, eyes can be a major effect of actually causing some type of headache. So let's look at tension headaches. Let's look at the signs and symptoms of tension headaches. This is going to be the first one that we're going to be talking about the three that I had mentioned. So it's head pain that's described as kind of a dull, achy sensation. Pressure or tightness in the back of the head, or even across the forehead, can be another indicator. You can also have muscle tenderness in the neck, shoulders, or scalp. This can be very similar to the cervical genic headache as well. Those have very good commonalities. And there's two main categories, which is episodic, meaning it just comes on for no reason, or chronic, meaning it's something you have, twice a week for the last 6 months. Just, doesn't matter what you do, how you do it. Get more sleep, less stress, all these things that we got your eyes checked. Again, that's an indicator that there's something else that's going on. So the episodic tension headache, it's going to last for about 30 minutes to a week even. I know, you're like, what? Occurs less than 15 days a month, or for at least 3 months. So yeah, on and off, on and off, on and off, on and off. And it's not fun. It's really not fun. As you can see that this lady's demonstrating here. Lasts for hours, or maybe be continuous. I know. Occurs 15 or more days a month for at least 3 months. Wow. Yeah. Then what's chronic, right? I know. It's actually worse. Cause of tension headaches would be increased muscular tension or contraction. Pain with amplification related to muscle tenderness. Many times when you have these trigger points, or what we call myofascial bands, that hold certain chemicals and toxins in there, and they actually get released and they cause the nerves to be aggravated or irritated. They're called neurotoxins. They can also cause these headaches. Tension headache treatments. These are the things, because we're a multidisciplinary office, that we can actually offer you here. Really excited. Chiropractic adjustments are huge in dealing with tension headaches. Proper alignment of the spine. With proper alignment, you get proper neurological communication. And with proper neurological communication, you get relaxation of muscles, you get balance of muscles, you get less stress on tendons and ligaments, and all these are culprits of actually these tension headaches that we were talking about. Physiotherapy, okay. Strength and stretching. Also, proprioception, getting that balance and coordination is so very important. Manual therapy, many times we have to do different types of manual therapy, like myofascial relief. We may have to do proprioceptive neural facilitation. We may have to do vibratory therapy. There's a lot of different. Sometimes we have to use different types of stones and instruments with certain types of lotions to actually work out those muscles. Those are all part of that manual therapy realm. Medications. Now, here we try to stay away from as many medications as we can, but since Dr. Doty is a triple boarded physician, we have that option that we can utilize that. So this is a true comprehensive team multidisciplinary approach. So we feel we have the best of the natural and we have the best of the medical. Sometimes we have to use trigger point injections because those muscles, regardless of how many adjustments, how much we exercise them, how much we do manual therapy, and how many muscle relaxers or medications that we may give, we need to go in there and actually inject them to get them to loosen up, okay? So the good part of that is out of all those treatments there, those 5 treatments, I would say the last 2 are used the least, a very small percentage of the time. So if that's something that we need to manage, we are totally capable, but I'm happy to report that again, those are the least that we use. Tension headaches versus migraines. And again, it's really trying to figure out what's going on here. So, can be difficult to distinguish, can suffer from both. Yeah, suffer from both, I know. Migraine headaches are usually associated with visual disturbance or nausea or vomiting, okay? Visual disturbance, many times people can talk about a kaleidoscope type of an effect, and many times that's what we call as an optic migraine also. So there's a lot of different things that can occur in that visual disturbance that we're talking about. Getting into migraine headaches can cause a pulsing sensation, throbbing, that vascular, that blood vessels that we were talking about, pain, usually on one side of the head, okay? Often accompanied by, again, nausea, vomiting, extremely sensitive to light and sound, photophobic, autophobic, can cause significant pain for hours to days, and can be so severe that the pain is debilitating. I mean, you cannot get out of bed, okay? You have yourself locked in a room, as cold as you can get it, and you're actually wrapped in covers because you're freezing. All the lights are out. You want everyone to be out of the house because you don't want to hear anything. And you're just trying to keep the pain under control. Man, that doesn't sound good. The warning symptoms, known as an aura, may occur before your headache comes on, okay? That includes flashes of lights, blind spots, tingling on one side of your face, arm or leg. So many times people get scared, oh my gosh, am I having a heart attack? Did I have a stroke? You know, what is going on, okay? Migraines can bring these similar symptoms on, okay? Because not only is it affecting the neurological, it's also affecting the circulatory system as well. Many triggers of migraines, hormone changes in women. I'm sorry, that's all I can say. You ladies are much braver and tougher than us men, because man, my wife, when she's having a hot flash, whoo, you know, those covers are flying off, or we got to turn the air conditioner down to 60 in the house, but bless her heart. Certain foods can actually activate a migraine. Certain food additives, big one is MSG. Like I was talking about food, gluten, chocolate, wine. I mean, there are a variety of things. All those things that many people love to indulge themselves in. Drinks that we were talking about, and good old stress. Stress can bring on that debilitating migraine. Migraine triggers, sensory stimulation, okay? So if you're an individual that is very sensory, okay, so when someone touches you, you really feel it, you know. Everybody, when they touch you, it needs to be light and gentle. You know, some people, come on, give me a hug, you know, they want that big bear hug. Well, people that are sensitive will get that overstimulation that can occur. We can kick them into a migraine, okay? Changes in your wake or sleep patterns. Many of you people possibly out there work jobs that there's actually shifts. So many times when you're moving from one shift to the other, that can affect you. Also, when our kids like to stay up all night on electronics and social media and think that, you know, they can sleep till 12 in the afternoon and then get up and stay up till 3 in the The morning, yeah, those are not good circadian rhythms. Those aren't good sleeping habits. But you say to me, wait a minute, I got 12 hours. What are you talking about? Yeah, but it's at the wrong time, and your body knows that. Changes in the environment. Again, certain smells. I don't know about in your neighborhood, but I know some of my neighbors really have an issue when they come by and they have those trucks and they're spraying for mosquitoes. Those chemicals that are put in the air really bothers them and will trigger that headache. Or possibly changes in the weather. A storm front comes in, so on and so forth. Medications can do this as well. Yeah, medications can actually cause this problem, as well as there's medications that can help you. So that's why we want to try to stay away from those so that we can not have those nasty side effects. But if we need to use them, we're ready and waiting. Causes of migraines, possible genetic or environmental factors appear to play a role, like we had talked about. So remember I was talking about your family history. So if your mom or your dad had them, that's really important. It gives a lot of good information. Possible changes in the brainstem and its interaction with the trigeminal nerve, which is a major pathway. Trigeminal nerve is right through this area, okay? That's cranial nerve 5. So it can be a major player in actually causing these pains. From a chiropractic standpoint, that's why our upper cervical work, the upper part of the neck actually works very well in dealing with those issues. Imbalance in brain chemistry, serotonin levels can drop during the migraine attack. So, and that may cause neuropeptides to release, which actually stimulates pain. So that could be one of the medications that can be used many times. Serotonin retake, uptake inhibitor type of medication many times that can be used. That's actually Dr. Doty's department, not mine. So migraine treatments, again, medications, chiropractic adjustments, manual therapies, physiotherapy, and injective procedures. Many of these things, like I had explained previously, use a lot of the same methodologies to resolve those things. Because when you're adjusting the spine, you can have a global effect, not only on the nervous system, not only on the vascular system, but also on the muscles that are surrounding it. So again, remember how we had talked about you can have a tension headache and a migraine? So sometimes relieving that tension headache actually triggers that migraine off. It really does. We talked about those different methods of manual therapy. We talked about different things that we use from a physiotherapy aspect. So your posture, all right? If your head's way out in front of you, that can trigger a migraine, okay? Injection procedures. Sometimes we have to do what are called suboccipital blocks because the pain is so intense. You've already tried a variety of very, very strong medications. Sometimes you have to really get those symptoms shut down. So sometimes you have to do those blocking procedures. And that's where actually the nerve is deadened, okay, to calm down that reciprocating cycle of pain that's occurring, that medications, chiropractic adjustments, physiotherapy, manual therapy, and possibly other injections haven't been able to. Getting to cervicogenic headaches, and we start the cervical part is with the cervical spine, which is your neck. Again, it may mimic a migraine as well, okay? Maybe intermittent, or it may become continuous. Again, there's no telling. It's a non-throbbing, okay? So remember the migraine had a throbbing or a pulsating component to it. The pain is the back of the skull, okay, or the base of the skull, back of the neck. It can actually go down your neck and in between your shoulder blades. You ever feel that? Yeah. And primary may be felt sometimes in your brow or your forehead, and also you can get a stiff neck with it. It's like, oh, I got this headache. It's just everything's just stiffening up. It can give you nausea and vomiting, okay, and it's not a migraine, and it actually can make you dizzy. And why it can make you dizzy many times is because the cervical spine has nerves in there, which are called mechanoreceptors, and they give your body, your brain, that positional sense. It tells your brain where it is relatively in space and how it should move. So if those nerves are off because those joints are imbalanced and they're not sending the appropriate signals to the brain, it can cause some dizziness. Cervicogenic headache symptoms, blurred vision, sensitivity to light and sound. I mean, just like a migraine. Pain in one arm or both, okay? Mobility difficulties, meaning moving your head and neck. Again, I got that tension. What's going on here? What are the causes? Often related to excessive stress to the neck. Car accidents. Sometimes, different types of sporting events can cause that. Even you weekend warriors out there, okay? Yard work, you're all bent over and you're doing all this work. Long hours at a desk. Long hours on your electronics. Long hours working at a computer. There's a variety of things that can happen. May result from a cervical osteoarthritis or a damaged disc or degenerative disc, which the movement that irritates or compresses these cervical nerves that are extending and coming out of your neck and feeding into your arms and your shoulder area. And you're communicating directly with your brain. Cervical spines, bony structures, and its soft tissues can be contributors. So like we were talking about, if the vertebrae are not moving properly, if you have these trigger points that are in there, all of these can be stimulants for this issue, or even if you have an arthritic issue also. Cervicogenic triggers current or prior neck injuries. So again, that's something we look in the history. Cervical disc problems, sleep difficulties, poor posture, muscular stress, and even fatigue. Okay? So those can all go hand in hand. Well, I hope that you learned something today. This was our first discussion of our 6-part series of the whole body. And we're really excited that we're getting this started from head to toe. I hope you learned something from Healthy Head, Healthy Life. And please, again, give us some feedback. Did you learn something from this? Did you have some questions that I didn't answer? Do you have questions about what we have to provide here? Are you a new patient, or our friends referred you to this talk because you have been suffering with headaches? We're happy to sit down and talk with you and see if that we can help you with some of these problems. And if we can't, we do our best to get you to the person or the facility that can. I'm Dr. Michael Vachon, the Center for Performance Medicine and Rehabilitation. Please check us out on gethealthystl.com, and please like us on our Facebook and Instagram posts. Thank you so much, and have a great day.